Doing a quick audio check. But really important information. We're glad to give all of you. Lots of people saying they can hear us. Okay, so that's great. Okay, so I'll just turn up my mic a little bit here. So saying it's a bit quiet. Okay. Very good. So tonight we're going to talk about the health and safety planning that we have for summer youth programs this summer. Should be no surprise to anyone that it's going to be a bit different of a summer, but we're really excited to have participants back on campus with us. So with that, we're going to jump right in. We have a lot of information to get through, and the most important is honestly the questions that you all have. So we want to make sure we leave sufficient time for that. This session is recorded, so we will be also sharing this out. If for some reason you lose connection or if you can't stay for the whole thing, we will have the rest of it available. So my name is Cassie. I'm the director of the Center for Educational Outreach here at Michigan Tech. Of course, our office does many things, and Summer Youth Programs is our flagship program that we've been running since 1972. With me, I have Amanda Jackson and Brad Wells as well. There they are. You should maybe see them in the corner. You'll hear from them as well. So as mentioned, we have a lot to get through. This might not even be all the bullets, so we're going to go pretty quickly. At any time, though, if you have questions, specific questions, please use the question feature at the bottom of your screen. And that will come right into our box here, and we'll either answer them as we go or at the end of the session.
So Michigan Technological University is a public research university. It was founded in 1885 in Houghton, Michigan. As we know many of the participants are already registered, so I would hope they're very familiar with Michigan Tech as a university. Michigan Tech offers more than 70 accredited graduate programs in engineering, science, technology, mathematics, business, and humanities. Many of our summer programs also model these different categories. We work directly with the departments as well. The campus is located in Michigan's Upper Peninsula, overlooking the Keweenaw Waterway, and is just a few miles from Lake Superior. So a little bit more about the summer youth programs. Again, we began in 1972. We started with just the Women in Engineering program and have expanded from there. So we've been operating every year, except for last year, unfortunately, of course, since 1972. So we try to offer an assortment of courses every year. So 50+ courses for students currently in grades 6 through 11. And we offer courses in engineering, science, technology, computing, business, humanities, and leadership. So quite a variety of programs, as well as competitive programs on top of that. Typically, we have had students basically respond through our student courses to surveys saying that they've gained confidence in their ability to successfully, to feel successful in a college atmosphere, which is part of the goal of the programs. And those numbers are from 2019 when we operated. And again, hoping that we can continue that great number through this summer as well.
Awesome. Thanks, Amanda. So many of you have probably already seen our emergency operations plan, which is the official term the CDC has asked camps to use. We're a pretty unique operation here, since we're not exactly a typical, kind of archery in the woods, rock climbing summer camp. Obviously, we run academic programs with this component of fun as well. And so we have created our own health and safety plan under the guidance of Michigan Tech Flex. So Michigan Tech Flex is a leadership body here at the institution, compiled from experts from many, many different fields, including epidemiology and our legal counsel and other entities at the university who guide decisions. So Michigan Tech Flex actually shaped all of our campus policies this past academic year for our undergraduate and graduate students. And we're really proud to be one of the only public institutions in the state that ran face-to-face courses all year, with the exception of the time we had to shut down due to governor's orders. And so, for any of you who have been up to our campus, We're remote. We're sort of on our own up here in the Upper Peninsula, and in many ways, that's a really good thing. We are able to create policies that really make sense for our campus and for our students. And so as we approach summer youth programs, we certainly wanted to take all of those same principles that we've learned over the academic year running face-to-face courses for university students and make sure that we were able to replicate the most successful, to have the best risk mitigation plan possible for summer youth. You can't click on your screen, of course, but there is a link here. We also have the plan posted on our website if you want to read it in its entirety. What we're going to do tonight is basically run through some of the most critical parts of the plan. And of course, like everything, things seem to be changing day by day these days, sometimes hour by hour. And so everything we talk about both tonight and in our plan, we are updating as new information becomes available. And so for that same reason, in some of your questions, if we don't have the answer tonight, we will work on getting it as soon as we can. And we really appreciate everyone's flexibility with this situation that we have. So we drafted our COVID plan based on 5 potential levels at which summer youth programs might operate. Actually, technically 4, because at level 5, unfortunately, our programs would be closed. Last summer, we were at level 5, so we were unable to run programming. Level 1 is, as you can see, near normal operations. We're presently at level 3. We do not anticipate this to change at this point. We intend to run at level 3 all summer. I think the only remote possibility is if things really take a turn for the worse, we might have to scale back to level 4. Fortunately, that's looking increasingly not likely. And so we're basically, all the information we're going to present tonight is on the assumption that we'll remain at level 3. And so there is information about the other levels available in the full COVID plan, but for the sake of tonight's session, we're just going to talk about level 3. All right, so what does level 3 look like? Well, basically, we do have required pre-arrival testing, which we will talk about later. We do ask that participants do 1 week of symptom monitoring. This is not required, but recommended. So prior to arrival on our campus or prior to boarding our charter bus service, we ask that, just every day, just kind of take stock for temperatures, for any of the known and common symptoms of COVID. And if you do find that you're experiencing any, please let us, our staff, know prior to your arrival. We ask that when possible, if participants could participate in self-quarantining prior to arrival. So, really keeping social interactions to those in their current household. We know that's hard, especially in the summer, and there are many fun things to do and people we haven't seen in a long time. It's really important, though, for our programs to minimize the impact we could have on a potential exposure. We are operating under cohorts, so you could use the word cohort or pod or whatever you choose. We base this off of the current state order in place by our governor of 25 people max. However, most of our cohorts are actually only 15 to 20 students each. And so what we basically did is each class that our participants take is going to become their own cohort. So if your student signed up for biotechnology, for example, they will be their own cohort. Our scholarship programs are going to operate a little bit differently because they are large programs. They will be grouped instead by the group project that they will be doing throughout the program. We will be doing double occupancy housing with members of the same cohort. Social distancing, we are maintaining 6 feet per the guidance of the CDC. However, we will be able to move to 3 feet of distance in the classrooms for specific activities, such as sharing a computer or sharing a microscope. So the intention being that for a temporary moment in time, if you need to be three feet or closer than 6 feet apart, we can do that. But otherwise, we're asking as much distancing as possible. And then face coverings are required both indoors and wherever social distancing cannot be maintained. It's really exciting news just in the last week or so about the use of face masks outdoors, perhaps not being as necessary as previously thought. We are waiting for policies on Michigan Tech's campus to reflect that as well. So, of course, with our programs, we have to abide by the greater campus policies in place. Presently, our campus still requires masks outdoors when 6 feet of distancing cannot be maintained. My guess is that that is going to change, but we have to wait to update our policies until that time as well. Okay, lots of questions about the testing coming in. We will answer those in a little bit here, if you want to just hold on to those. And then from here, I'm going to turn it over to Brad.
All right. So for this summer, we plan, as Cassie had mentioned, to be having our participants in cohorts, and we'll be assigning those cohorts in an effort to really reduce the risk of exposure for all of our participants. As she mentioned, 25 participants max, mostly in that 15 to 20 range. And these cohorts are going to be grouped based on the course that they're in. And they'll be maintained as independent units throughout their time at SYP. So that includes indoor dining activities when they're in their housing. So their roommates will come from within that cohort for the extracurricular activities in the evening that we'll talk about a little bit later, and especially on transportation within SYP. We really will, to the best of our abilities, discourage the mixing of cohorts, and if it does happen, we'll keep those overlaps as minimal as possible. Just we really want to focus on participant safety this year. So now probably what most of you are really interested to know about is our face covering policy. At this time, and as we see it playing out throughout the summer, masks are required indoors and anywhere where we cannot maintain social distance. This is regardless of your vaccination status. We ask that all face coverings should be made of new, tightly woven fabric, and that they should cover your nose, your mouth, and your chin at all times. If you were interested in plastic face shields, unfortunately, we're not going to allow those this summer unless they are in conjunction with an approved face covering as described previously. So those plastic face shields are fine, but we need you to wear a cloth fabric mask with that as well. The face shield alone just doesn't do enough to knock down the water droplets or the vapors that can transmit the virus, and so we really want to make sure we're playing it safe. We do ask that all participants bring 10 face coverings with them for each week they intend to be at SYP. This just gives you one for every day and a couple of spares in case you fall in the mud or do something else on your awesome adventures out in the lab or in the woods.
All right, so we're about to answer many of the questions here that have rolled in live. So pre-arrival testing. So we are currently in discussion with the Abbott labs. And so what our intention is at this point, and because we're still in discussion, I have to let you know that this could still change, but we are fully intending on securing the sort of like instant rapid tests that participants would take at home. This would be at our expense. So we intend to purchase these from Abbott Labs. We would mail them to your home. It's, effectively like a home pregnancy test. It's a pretty, in fact, it looks very similar as well. You would take that up to 3 days, so no more than 72 hours prior to either getting on our SYP bus or coming to campus. And the result there would basically, if it's negative, then of course proceed, per normal. If it's positive, in that case, we would want to discuss what the options are. Options, of course, would include switching to a different program later, or going for full tests from a local medical provider near you or somewhere else to basically confirm the positive or disprove the positive test. So we will be sending a lot more information as soon as we can confirm these home tests with Abbott Labs. I will say that we've had really great experiences with using Abbott as a campus. Michigan Tech has been using the Abbott tests with our athletics department for all of our athletes this past year, and they were very effective and very accurate as well. They are FDA approved, and all in all, we feel pretty comfortable with using Abbott as a sort of asymptomatic prior to coming option. And of course, for all of you, you probably know that it's a journey to come to Michigan Tech. The last thing that we would want is that you would travel all the way here and then find out that maybe your participant is positive. So our intention really is to try to have as much information prior to coming up to campus. So, questions are about, do you need to do the test if you are fully vaccinated? Yes, at this time, we would still ask that participants that are fully vaccinated take the test. Again, it's at our expense. And so we are willing to, still do that in the name of just being absolutely certain. The 3-day time is really the moment of the test. The result comes, I think, in about 15 minutes, Brad, is at
Yes,
max.
15 minutes, and then the results of the test are valid for 72 hours after that.
Yeah. So let's see, I'm reading through the question. I think that was most of the ones about the testing here. And so we will also, this is the intention of these tests is to catch any potential virus spread in asymptomatic individuals. Somebody who has symptoms and is experiencing symptoms should not rely just on these tests. They would need to go for full testing through a medical provider.
Before we jump to hygiene and sanitation, there's some questions about masks I think we could jump back to, Cassie.
Yeah, sure. Perfect.
So there's questions about disposable medical masks, KN95s, the surgical masks, and whether those would all be acceptable, even paper face masks. Would you like to elaborate on that a bit? And I'll get these.
Yeah, sure. So we are going off of what the CDC guidance considers as an acceptable face mask. I believe all of those would be considered acceptable. So either cloth or surgical would be fine. If it is something like a neck gaiter, it does need to be folded to have two layers to cover the face, the nose and mouth. Scarves and balaclavas do not count according to the CDC. So there is a helpful link on the CDC page that kind of outlines what is acceptable and what isn't, and that is linked in the original plan itself. So that can be consulted. Brad, are there other specific questions there?
Oh yeah, they're still coming in here. Let's see, we've got some testing questions still.
Okay.
Is it possible?
Why don't we'll keep rolling and we'll circle back towards the end here. Okay.
Sounds great.
Oops.
All right. So in addition to the face masks and the pre-arrival testing, we do want to emphasize the need for extra hygiene and sanitation this year. We're really going to encourage regular hand washing, and we will be providing frequent hand sanitizing stations with hand sanitizer containing at least 60% alcohol throughout SYP. Hands should be washed whenever a participant enters transportation, before their meals or snacks, after using the bathroom, and after touching shared surfaces. We do encourage normal practices such as covering your cough and sneeze, especially coughing into your elbow, to really make sure we're knocking down as many of those particles as possible. We recommend refraining from touching your eyes, nose, and mouth with unwashed hands. And we will be enacting enhanced cleaning of all high-touch surfaces this year.
So a little bit more about our symptom monitoring. So we are asking that all participants and staff, they're going to complete symptom monitoring daily for the following symptoms. So that's a cough, fever, shortness of breath or difficulty breathing, congested or runny nose, diarrhea, fatigue, headache, muscle and body aches, nausea or vomiting, new loss of taste or smell, and a sore throat. So they'll be able to track if they have any of these symptoms or if they have none of these symptoms. We are asking parents and guardians to complete a symptom clearance form before check-in. So during that check-in process, they'll have that form that we'll provide for them to complete, or before they're boarding the charter bus service, if they're getting on the bus. Commuter students will have to complete symptom monitoring upon arrival every day as they arrive to campus before their class. For students who are living in the dorms, during the week, our staff will take care of this symptom monitoring during the program.
Great, thanks, Amanda. Okay, so isolation, illness, exposure, quarantine. So we'll be monitoring symptoms of participants daily, as Amanda mentioned. If the participant displays 2 or more symptoms basically for us, that is going to trigger our potential COVID response. And this is where things admittedly become a little more complicated from our sort of logistical standpoint. We are working out many of these details still, which are changing as information changes as well. How we intend to proceed at this point, in consideration of the fact that our programs are typically 1 week. We typically only have a participant on campus for 1 week. And you know, the word really just came today that the FDA approved the Pfizer vaccine for youth 12 to 15 years old. So, you know, at this point in time, if individuals wanted to get vaccinated prior to attending our programs, it is going to be possibly difficult for them to have full vaccination prior to arrival. So taking all of these things into consideration, for us, if a participant displays 2 or more of the known and common symptoms of COVID, we're basically going to have to operate on the assumption that it could be COVID and act accordingly. So what that basically means, we have an isolation ward that will be set up in Wadsworth Hall. Using the word ward is a little bit scary, but basically it's just a different set of rooms that look exactly like the same rooms that other participants are in, just in a separate part of the residence. And basically what we will do is we will put that participant into the isolation space, and then we'll immediately call the parent or guardian. Now, at that point in time, we basically have 2 options. And those options are going to also depend on where we're at in the week in the program. I mean, if this is occurring on a Thursday and there's only 1 day left in the program, that might influence the parent guardian decision at that point. But if it's on a Monday, that might also be different. So how we intend to proceed is basically we will give parents and guardians the option to consent for us to take the participant to get the PCR testing at our local medical provider. Those will be done through Upper Great Lakes Family Health. It's a clinic that's just on our campus. Those results can take up to 48 hours. We are working to see if we can get expedited results, given that Michigan Tech has a very close relationship with the clinic. In either case, so parents could either consent for testing, and of course, if testing comes back negative, the participant can rejoin the program right away as soon as we have those results. If the test is positive, or if the parent or guardian does not want to send for testing, then we are going to ask that parents and guardians pick up the participant within 24 hours of that notification. Now, we know that many people live far away and that it can be complicated to travel to campus. Of course, we will work with you, but we are thinking about what is in the best interest of participants as well. Sitting in an isolation room for 3 or 4 days is obviously not the type of experience we want to provide. We will have as many activities and things that we can deliver to their room, but it's obviously not going to be in an ideal situation. So the other piece here is if parents and guardians do provide consent to get the participant tested through PCR testing, we will request that you share those results with us. As the parent or guardian, you will receive those results, not our staff. And so in order for us to receive them, you will have to sign a release. It's very important information for us so that we can proceed with the rest of the cohort if those results are positive, and we can provide, you know, exposure notification to those families. So, you know, when one participant from the cohort displays symptoms and they go into sort of our isolation space, the rest of the cohort also enters what we're calling Cohort Quarantine. Good news is that doesn't really affect them too much. They still get to go to class, but everything they do from that point forward is contained to their cohort. So they go to class as a group. All of their meals will be delivered to them in their rooms, so they will have to eat in their rooms. And then the evening and optional activities will be conducted for them as a cohort. So they won't be able to mix with other cohorts after that point until we receive notification that the test from the participant who is showing symptoms has come back negative. If it comes back positive, then of course we would notify all the parents and guardians of all participants in that cohort as soon as we have that notification. I'm sure there are a lot of questions about that, so please feel free to chat those in and we'll get through them as best as we can here. About vaccination, so of course we highly encourage vaccination for all participants and also for our staff. We do not require vaccination for participants or staff. And keep in mind that fully vaccinated means having both doses, at least of Pfizer, and we're hoping that Moderna will also be approved soon, and waiting that 2-week sort of incubation period following the second dose. We have a program this year called CampDoc. If you're fully enrolled in summary programs, you should get an email about that. If you haven't gotten it yet, you might get it in a week or so. CampDoc is where you input all of the health history information about participants, including things like dietary restrictions and allergies and other things that we need to know. We did also just today add a new point in CampDoc for people to disclose if their participant will be fully vaccinated prior to arrival or not. And you can also choose that you prefer not to answer. Just for the record, CampDoc is HIPAA compliant in its security. And for our staff, we only will access that information on a need-to-know basis, which pretty much would only be contact tracing if needed. So, you know, providing that information to us does not in any way affect the participants' participation in the program, but it does impact what we may need to do in the situation that we have an exposure. I think it's over to you, Brad.
It is. We do have some questions about quarantine. If you wanted to jump back to that, Cassie, or do you want to wait till the end?
Perfect. Yeah. Why don't you keep going, Brad? And I'm chatting away answers here as
Awesome.
we go. Okay. Perfect.
Perfect. Okay. So within SYP and getting to SYP, there's a lot of transportation involved because, well, we're pretty far up here from just about anywhere in the state. And if you're interested in the charter bus service that we offer, we still will be running the charter buses this year, but we will be operating at a 50% capacity. When participants are on the charter bus, masks must be worn at all times. Before boarding, we do ask that parents or guardians complete a symptom clearance form for the student to just verify that they haven't had any known symptoms in the last week or so. And during the boarding process, all participants and their parents must be wearing masks as defined by our face mask policy. Once the participants are at SYP, we will be transporting them in 15 passenger vans and some other Michigan Tech owned vehicles. These vehicles will be sanitized between cohorts, and the staff that are driving the vehicles will be from the staff that are always working with each cohort. Again, masks must be worn at all times, and whenever the weather permits us, which is most of the time during the summer up here, we can have the windows down in there to increase circulation. And we'll be only allowing one cohort in each van. We will not mix cohorts within the vans. Okay. All right, so in the past, we have had a policy where parents and guardians or family members in the area could come and check their participant out of SYP to visit with their aunts and uncles or grandparents or anything like that. Unfortunately, this year we're not going to be allowing that. Participants may not leave during SYP, just as a way to keep down any outside exposures. We can make exceptions on a case-by-case basis, and we encourage you, if you would need to pick up your participant during the program for some reason, to contact our office ahead of time so that we can work with you on that request. For our commuter participants who don't really have a choice but to leave campus every day, we do ask that you make sure you're arriving by 8:45 every morning to give us time to do the symptom monitoring, and then you may leave after your 4:30 class ending. You're welcome to participate in evening activities with your cohort, and we do ask that when you're outside of SYP, please minimize your contact with others outside of your household for the duration of SYP and also before your time at camp.
All right, a little bit more about housing. So for students who choose to live in, they will be living on campus in Wadsworth Hall, which is the largest residence hall on Michigan Tech's campus. They will be on 4th and 5th floor. So we separate students by gender and floor with tap access through their IDs. We offer 24/7 supervision within the residence hall provided by our trained SYP counselor staff and head staff and on-call professional staff during all hours. So we are doing room assignments For students this year, they will be double occupancy. So students will have a roommate from their same cohort if possible. If not possible, then it would be an individual room, sometimes with the numbers how they fall. As I said, they're going to be based on their cohorts in order to keep that group together as much as we can when they're in that close proximity. Students do not need to wear a mask during the time that they're sleeping in their room. I know that was one question that we had. So when they're eating meals and when they're sleeping, they're not permitted to wear masks. So roommate requests will be granted only if they're in the same course and cohort, regardless of vaccination status. I know this is a question we've been getting. We have been directed by the Flex team that this should be the route that we take. We understand if students are vaccinated in different classes, they may want to room together, but in order to try and remain consistent, we are going to only have people room together if they request it and they are in the same course. So meals will be served within our large dining hall right in Wadsworth Hall. It's going to be cafeteria style, but there won't be any self-service. The dining staff will be serving the students the food that they choose while they're in the dining hall. All meals are going to be served in to-go containers. They're still going to have all of their regular marks for dietary restrictions showing gluten-free, dairy-free. Any of the specific dietary restrictions that a student could want will be labeled on the actual cases where the food is. They can also ask any of the dining staff if they have any questions as far as dietary restrictions for specific meals. So they will be served those things in to-go containers. Meal times will be staggered slightly and coordinated by cohort. So cohorts would arrive and depart together as they go through the dining hall. We will have the option for some students and groups while there's space to eat within the dining hall. We also are going to have some outdoor spaces available for students, picnic tables, different areas. They could go to their room. So there's a variety of dining options for students based on how full the dining space is and what's available at that time. We do have permission to seat by cohort 6 to a table within that dining hall. So that will be an option as well for students if there's still space in the dining hall. So in the evening, cohorts will have a variety of safe, supervised activities with our activity counselors. These are going to be indoor, outdoor games. We have different hikes that we'll plan, beach trips, arts and crafts. So we do have a variety. Obviously, we can't keep all of the same activities that we have done in the past, but we are working really hard to figure out a variety of options for students that will still be safe for everyone to participate and keep our community safe as well. So there will be some activities that students can do with students from other cohorts. Obviously, those are going to be better to do in an outside space, maintaining that 6 feet of distancing as well. So they will get to see people from other cohorts, but for trips where they're driving together or things where they have to be slightly closer, those will be done in cohorts. So a little bit more about the SYP experience. So classrooms and lab capacities have been adjusted to allow for social distancing for every course to keep both instructors and students safe. Social distancing of 6 feet will be maintained whenever possible. 3 feet in the classroom for, you know, as Cassie mentioned, those temporary activities, things that they may need to do together or with another partner, but only as needed. Outdoor classes when possible. Some courses do many of their different activities and hands-on things outside anyway. So when we can move classes outside, that will be an option that instructors are looking at integrating into class activities. And instructors and faculty, they're encouraged to be fully vaccinated prior to being instructors as well, in order to, again, reduce any potential exposures that students may have. And then a little bit more about our staff. So to the extent possible, our summer youth program staff will be assigned a cohort to work with during each week, again, to reduce crossover and possible cross-contamination. Again, to the extent possible, residents and activity counselors will mostly only interact with that same cohort of students. We have hired extra staff this year to allow additional coverage in the event of exposure and just to adjust as needed. And our staff is mostly made up of Michigan Tech undergrad and graduate students who have been at Michigan Tech for at least a semester, and they're all very excited to this summer to be able to stay not only up here for the summer, but to come back and be able to work for the summer youth programs again. Many of them have worked for us in the past and missed out on working for us last year, and again are very excited to be back and be able to help the students have a great experience on campus.
So for our check-in and check-out procedures this year, we are planning to offer a curbside service. Check-in will be offered on Sundays from 10 a.m. to 2 p.m. with checkouts then on Fridays from 5 p.m. to 7 p.m. and Saturdays from 9 a.m. to 12 p.m. For both check-in and check-out, we will have extra staff available to help participants move in and out, and elevators will be accessible to help with moving luggage. During both the check-in and check-out procedures, only participants will be allowed in the buildings. We will not be allowing parents in at this time.
And on that note, you will this year actually choose a check-in time on CampDoc. So we are trying to manage the flow of traffic to campus those days, obviously. And so we're asking you to please select a 1 hour slot between 10 a.m. and 2 p.m. That you plan to arrive on campus. All right, so as I mentioned, we are using CampDoc this year. So if you aren't sure what that is yet, you'll be getting an email soon. We also have a new medication and medication dispersal procedure. So we're using PillPack this year. This is the first time for us. We are aware of a couple of hiccups already, and we are working through those. If you experience any issues with PillPack, please let us know. More information about PillPack will be coming in the welcome packets that we'll be sending in the next few weeks, which will really be the next big communication from us, and you'll be receiving those by mail with all kinds of checklist items, things like what to pack, what to bring, more about arrival options, and so forth. I did say we had a question about dress code for scholarship programs. That information is actually presently on our website. There's a space in there. I believe, Amanda, is it under the what to pack page?
Yes, I believe so.
And then students who are going to be in a lab setting of any kind, please make sure you bring closed-toed shoes and long pants as well. We need full covering of pants and full covering of feet for lab safety. We will also have some additional forms, of course, this year with all of these different procedures, really just affirming that families understand all of the new COVID expectations and procedures. So those will also be coming out very soon. So with all of this, we certainly wanted to make sure that we explained a little bit about our refund policy. Basically, you know, all the details are kind of here in the chart, but if you have to cancel your participation for any reason related to COVID, we want to be as flexible as we can and, you know, work with you in to the best of our ability. So, you know, please let us know whatever may happen should you need to change your plans. Anything prior to June 1, we will do a full refund of cost paid except for the $100 non-refundable deposit and the bus deposit if you have signed up for the charter bus. Anytime between June 1 and program start, we can, of course, offer you a seat in another course if we have to cancel the course, or if you choose to cancel your participation, then you'll see the fund there, basically the same procedure, full refund of everything you've paid except for the non-refundable deposits. And in the event of COVID illness or exposure or something that would prevent you outside of your control from coming, we'll do a full refund of all that we can to make that not so stressful on you. During the program, if we're in a situation where there's illness or your participant goes into isolation or something like that, and obviously you're not able to take advantage of the program in the way that you anticipated, we'll basically do a refund prorated of, you know, what is remaining of the program that you're missing up until that point. Because we just don't, you know, we know that we're asking so much of families and participants this year, and we want to do the best that we can to really work with you to the best extent possible. Right, now questions here. And so I can answer a few real quick as Brad and Amanda are catching up on those. So got a couple questions about whether the participants can take a test before coming home from campus. That's a really interesting idea. We hadn't actually thought about that. That may be possible. At this point, we obviously are intending to order a bulk batch of the Abbott Labs tests. I can foresee where we may have some surplus that if a family would like a participant to take one prior to returning home, I would assume we'd be able to do that. Please note that the Abbott tests are not for symptomatic individuals, so those are asymptomatic tests only. If somebody is symptomatic, they really do need to be confirmed by a PCR test in a clinic. Housing. So as we mentioned earlier, so housing is double occupancy with students in the same cohort. Unfortunately, we just got word today. We'd been asking our Tech Flex team if we'd be able to allow double occupancy of students in different cohorts if both were vaccinated. And unfortunately, the answer that came back was no. They really prefer that only students in the same cohort are roomed together. So that is what we're going to abide by. As far as single occupancy rooms, so we have very real space constraints, as you may imagine. And because of our cohort structure this year, inevitably more students are going to have single rooms. However, we're going to ask that people not request a single room unless you have an extenuating circumstance. And we can talk through those with you individually. That said, there's a large possibility, especially if your participant is female, that she may end up with a single room because in some of our cohort structures, for example, if we have 8 students in a program and 7 are male and 1 is female, well, that female is not going to be roomed with somebody from a different cohort. So she would, in that case, get her own room. So we will have a greater number of single rooms this year, but we are asking that those requests only be made when there are extenuating circumstances. As far as the what the facilities look like, each floor in the residence hall has a few different community bathrooms that are kind of parceled out by cohort. And so they each have independent shower stalls with, I believe, even independent sinks and toilets in them, or they have kind of a more community style layout with individual stalls and sinks and so forth. So I think there was a question on that. I hope that answers that. And then there is a question about assignments with roommates. Amanda, do you know how can a family confirm an assignment, or when do they receive the assignment typically?
We typically don't share roommate assignments until, you know, they arrive and they find out who their roommate is. If you request if both students request each other as a roommate and they are in the same cohort, the same class, we will honor those as we're able to. But we don't share roommate requests or roommate assignments prior to arrival.
So it looks like there's a few questions about both transportation and checking in. So it says, what time do we put for drop off if being picked up by a bus or van? So actually in Camp Duck, there's a drop down that says charter bus. So when you select that, then what you would actually do is pick your bus stop from there. So we have, I think, 4 different bus stop options available. They all pick up pretty late at night on that Saturday, and then it's an overnight bus to campus that arrives the next morning. So you would therefore just pick the bus stop that is most convenient for you. It does say here that families can purchase the Abbott tests at large pharmacy chains. They're all available over the counter. That is great news. That's fantastic. We are willing because we really committed to doing everything that we can to ensure the safety of participants. We're putting out the expense on our behalf, so we will be sending those to you regardless, but it is great to know that information, and hopefully you could use those even other times throughout the summer as well.
We do
Can someone who is not a parent pick up the student at the end of camp? So as long as they are listed as an emergency contact or they're approved, an approved individual, we would have to have that in writing from the parent or guardian in advance. That is no problem.
Cassie, can we jump back to the over-the-counter Binax Now tests real quick?
Yeah.
Okay. We do ask before coming to SYP that you use the test that we're sending you, because that will, the way that there's an app that comes with it that walks you through how to administer the test. And it also provides you with a certificate at the end so that we know the test result. And that's super important. The way Abbott has explained it to me is that that's a feature buying direct from them has, where you don't necessarily have that when you go over the counter to CVS or Rite Aid or those types of places and purchase the Binax Now tests. So they're perfectly fine. They're the exact same test. In terms of thinking about them for when your participant returns home, but on the front end, we do ask that you use the ones that we'll be sending out.
How is check-in and out organized with the charter bus? Amanda or Brad, can you take that one?
Sure. So the charter bus arrives before our check-in period, so they essentially have their own check-in process. So we'll work to get that group of students unloaded and checked in, and give them their IDs and review information with them and give them their everything they need to get checked in and show them where their rooms are, all with that group.
We lost you for a moment there, Amanda.
Sorry about that. That group would check in basically before the check-in period begins for the general SYP family groups. So they would have their own period basically from like 9 a.m. to 10 a.m. where we would work with that group of bus students to get them checked in and into their rooms and everything they needed for that check-in process.
Perfect. So when do commuter students need to check in? Do they check in on Sunday or they check in on Monday morning?
We typically have commuter students check in on Sunday so that we can be sure to get them all the information they need to be ready to go on Monday morning. If they're not able to come on Sunday, we can do that all on Monday, but we do request that they come on Sunday as well.
And commuter students, I'm not sure if we mentioned this, but they will take part in the symptom monitoring upon arrival daily before their class as well. We will have them check in with staff.
Mm-hmm.
So pick up and drop off for planes. So we actually send our counselors to the airport. We provide the transportation to and from CMX Airport. And CMX is serviced by United Airlines. We do encourage that you check their unaccompanied minor policy prior to booking flights. Don't quote me, but I think that they can fly as young as 14 unaccompanied. Younger than that, I do believe you have to purchase an additional program, like a flight attendant to assist them throughout the travel or something like that. But we regularly have participants flying into the airport. And so we would take care of all of that. Within CampDoc, you would actually upload the itinerary, so we'd be on the lookout for them. And if you've never been through the CMX airport, it's about the size of a 7-Eleven, so I promise it's very easy for us to find participants, and we're quite accustomed to that.
There's several questions in here, Cassie, about how far in advance we'll be sending out the test kits.
Yeah. So our intention would be that at the latest, we'd have them in hand 2 weeks prior to the program. Ideally, we'd have them out to you sooner than that. We know that many people may be traveling or camping. If you have specific plans and you're going to be, I don't know, on some like rural camping trip for like a month or something, please just let us know. We'll work with you as closely as we can to make sure we can get it to you in time.
Absolutely. Please contact us at syp@mtu.edu. We'll be glad to help you out in every way we can.
There is a note in here from a parent saying that all Michigan high school athletes have been using the Abbott tests all year or all spring, and that it's super easy. So thank you for that testimonial. That's great to know.
One of the things that's really nice about the rapid tests is that they only go, they're anterior nares tests, so they only go into that first little part of your nose. It's not the nasopharyngeal that gets rammed, feels like they're ramming back trying to find your brain. It's not those tests. It's much more comfortable than those.
Perfect. So I think one of the biggest uncertainties here for us, for the CDC in general, is about how the vaccination can change procedures. And so I know that there have been a lot of questions about that this evening. We are waiting for further information. At this point, a vaccinated individual does not have to quarantine prior to coming to Michigan Tech, prior to coming to camp. We would still ask that they would take the rapid test. If a student in their cohort ends up going into isolation and demonstrates symptoms, a vaccinated individual would not have to go get tested or worry about that. However, we will still quarantine the cohort, so they'll still be in a quarantine cohort per se. Now, we would require at this time that vaccinated individuals continue to do symptom monitoring, which for our programs they would do anyway. In the very remote chance that a vaccinated individual shows symptoms, the CDC does currently advise that they do be seen by a medical provider and do go through testing. But these are things that are still sort of, I think, in flux as the number of people who are vaccinated is increasing and the more data and information becomes available. So all of this information, as we mentioned very early on, is in a much, much more comprehensive plan. That's available on our website. You can read the whole thing through there. It is a Google Doc, which means we update it probably daily live at this point as much as we get new information. And so you are welcome to continue to check that document. In fact, we would encourage you to do that. So there is a question in here, will any of these rules be changed? I think the answer is they certainly could be. As you know, I don't anticipate at this point that we would, hopefully we won't need to restrict any further than this. Our hope is that if anything, we may be able to make more accommodations as more information becomes available. But at least at this point, the best source for the most accurate and up-to-date information about our procedures is going to be that live document. And then of course, just reaching out directly here, you see all of our contact information on the screen. And because all of these are sort of iterative situations, if you have very specific concerns, please contact us. Let us work directly with you and what's best for your child or your participant. There is a note in here about flights to CMX. There are 2 flights a day, that is correct. You know, one is in about like noonish and the other one is about midnight. We definitely still provide the pickup at the midnight flights. The best thing about hiring college student counselors is that they're up most of the night anyway, and they're typically happy to get to go to drive to the airport. And anyway, we pay them for that as well. So yes, don't worry about the flight times. It's a small airport and we're quite aware. It does not matter. We just need your itinerary in advance so we know to look for your student.
Yeah, and if you were to plan to try to have your student arrive for that late Saturday night flight, since there are no meals added, we would not have that be an additional charge. We would just pick them up and then basically do a quick rundown and get them in their room so they can get some sleep and connect with them again in the morning.
A couple of questions about quarantine. So if a student goes into quarantine, so this could either be, so if they go into quarantine, that means that another individual in their cohort is showing symptoms, not that participant. We would notify parents and guardians at the time that we have notification that someone in the cohort has symptoms. And the whole cohort goes into quarantine, we will notify parents and guardians of all the individuals in that cohort. Of course, you have the option at that point if you would prefer to just pick up your participant. Again, we know that the nature of our programs only being 1 week long. If something like this happens on a Wednesday and you're concerned that they're going to be basically missing out for a day or two and you'd rather just pick them up, we understand and we'd be happy to work with you on that. And so, we'll probably work through those situations best when they arise. Hopefully they won't arise and we won't have to worry about that. But absolutely, at any time, if either you or your participant prefers to just leave the program, we will work with you. And, you know, we're talking about COVID, but in a normal year, students get homesick, students have allergies, students get bug bites. We have a lot of mosquitoes here that apparently many students aren't quite used to. You know, we will work through these situations on a normal year for a variety of reasons, and we will work with families for what makes the most sense.
We had a
There's
question.
a question. Go ahead, Brad.
Sorry, go ahead, Cassie.
You're probably reading the same one. There's
The
a
cell
question
phone
about
call?
cell phone. Yes.
Yep.
So will campers be discouraged from being on phones during the day? So typically we have a no phone policy, at least in classes, just as if they were in school. And then this year we're implementing a mandatory no screen time that would be every evening from 6 to 7. And so we will have mandatory evening activities by cohort for that 6 to 7 hour. Our intention with that is because we know that screen usage has been very heavy this year, and a lot of the feedback we got from parents when we were pre-surveying about SYP and what families would like to see, overwhelmingly we were hearing a lot of families concerned about social interaction, mental health, and overusage of screens. And so we implemented this new sort of mandatory activity hour because we're wanting to help families to combat some of those things. And so our intention is to gently push students out of their set comfort zones and take them on activities they might not select on their own to try some new things. 7 p.m. until on-floor time at 10. They can then choose from a variety of other optional activities more suited to their interests. During those times, we don't typically, we don't necessarily police cell phone usage. Oftentimes, though, they're pretty busy not being on their phones, if I can say it that way. We do always discourage that they bring any sort of large, expensive electronic device to campus, especially laptops. We ask that they not bring laptops for the most part. We provide all of those in the courses that require them.
We had another quarantine question come in, Cassie. If your cohort has become quarantined for the entirety of SYP, would you get your money back?
So with the cohorts being quarantined, the experience is not going to change all that much for them, except for the fact that they would no longer really be able to do the evening optional activities with other cohorts. They'd still have evening activities that they can choose from. So because they'd still be receiving the full benefits of the academic experience and they would still have options, we would not likely provide a refund in that situation unless they decided they'd prefer to depart the program early, in which case, of course, we would prorate as discussed. There's questions about, can they carry their phones and then keep them in their rooms, and can they take pictures during class? Amanda, do you have thoughts on those?
Yeah, so some classes may tell students if they are able to bring their cell phones, maybe they're doing something where they're actually using it. But we do ask that students aren't on their phones during class. If they want to have their phone in order to take pictures during the program, that may be possible. We do have a photographer that will be taking pictures throughout the week for all the classes and putting those available on our Flickr website so that students can also go and download any pictures of themselves during the program as well. So again, I would probably check with each instructor what they prefer for cell phone use during each program.
So we have a question about swimming as an evening activity and how that would be supervised. We do have 4 lifeguards, I believe. Is that correct, Amanda?
3 lifeguards.
3 lifeguards on staff.
Yep. So we may have some swimming outside with, in lakes. We do also have the option. We may have some cohorts going up to the pool at the SDC. If they're up at the pool, they have lifeguards provided along with our counselor staff. So there would be multiple people there supervising students. If they are at a beach or even for some classes, they're just near streams or within water in some way, there's always a lifeguard around for those. At a beach, we would also have counselors and lifeguard staff available to supervise. But please bring a swimsuit. There may be options to swim during the summer, weather permitted, as always in Upper Michigan.
Will instructors be contacting the campers with expectations prior to arrival on campus? So typically the instructors won't. However, there will be communication from our office. The biggest one is going to be the welcome packet that you'll be getting in the mail in the next few weeks. That will detail a lot of questions. Then our website also has plenty more resources there to comb through.
We had a question about checkout, whether it should be Friday evening or Saturday morning, if there's a preference. There's no preference on our end. It's whatever suits the parent or guardian who's picking them up.
The vast majority of our participants do leave Friday evening, so it can be a little lonesome that Friday night as far as activities and things like that, but it is up to you. Great. Seems like that's the majority of the questions here. There's a question about if participants will be given a map so that they know where to go with times and agendas. So yes and no. So upon check-in, everyone will get a map. We do have very strict campus boundaries, so our participants are only allowed to, they're basically confined to campus itself. And for safety reasons, they're all given a lanyard with an ID that gives them tap access into the places on campus that they are permitted to go. They're not allowed, for example, into floors of other genders and things like that. So they will get a map, and then the first day of class, our counselors will walk all the students to class and show them kind of where everything is. The next few days for the rest of the program, though, this is where they start to really build those independent skills. They do, need to wake up on their own. They do need to make the choice if they're going to sleep through breakfast or if they're going to get up in time to have something hot. And then they do need to get to class, on their own. In that sense, it is on them. However, we are prepared for the fact that they're developing young adults, right? And so we certainly pound on a lot of doors in the mornings when we don't see them come down through the hall to go to class. And then they will also, because they'll be in cohorts, they will be able to follow their cohort members through the halls and kind of guide themselves to class. We have staff everywhere. We have activity counselors that their entire portion of a job every morning is that they basically rove campus looking for lost participants that might not be sure which building to go into. So we've been doing this since 1972. We've got a really good handle on making sure everyone feels confident that they can succeed in the program and build up some of those skills.
We had a question too about if they had selected a pickup window of maybe Saturday evening or Saturday morning, but are able to come earlier sometime Friday, could they switch and then pick their student up earlier? Absolutely. We will be keeping an eye on how many people are doing the checkout process, Friday versus Saturday. Checkout does not have the hour time limits for you're not setting like I'm going to check out from 6 to 7. It's more just Friday or Saturday. Just give us an email or give us a call if plans change and you plan to come earlier. Obviously talk to your student, let them know you're coming earlier as well so they can try to get their room cleaned out and start packing and things to get ready to go. But just let us know and we can work with them to get them checked out ahead of time. Same thing if plans change for later. Obviously, we will work with you to let the student stay that extra night and get them checked out the next morning.
Great. Are there any last questions as we wrap up here? All right, well, as a reminder, so this was recorded, so this will go on our Facebook page. We will also email this out to all of those who registered for tonight's session. Really want to thank all of you for not only just attending, but for the great questions that you've asked and for engaging. And more than anything else, just the flexibility and patience and understanding. We know a lot of these things are not ideal and not desirable. And we know that it's been a way too long of a very difficult situation that we're all trying to figure out in the best that we can. So truly thank you for that. We really look forward to meeting you on campus this summer in the safest way possible and creating a wonderful experience for these children and young adults. All right, have a good rest of your evening.